Hello, my name is Stephanie Tate Paterson, and I am a Doctor of Nursing Practice student at Maryville University. Today, I will present to you my DNP project titled Determining Face Mask Compliance of Teachers Returning to In-Person Remote Instruction. Committee members, I would like to thank Dr. Elby from Maryville University and Dr. Jerica Ampadu from SIUE University. The big question for this project: will an educational intervention improve face mask compliance for teachers in the return to in-person remote teaching during the 2021 COVID-19 global pandemic school year? We will first discuss a short summary of the project. 34.4 million cases, 608,000 deaths, and counting are the data tracker rates of COVID-19 in the United States. The alarming rates continue to plague our lives and our previous way of living. The abstract of the project is broken down into the following categories. Purpose: a quality improvement project to determine if an educational intervention would increase mask compliance of junior level and career and technical education CTE teachers returning to in-person remote instruction. Background: the 2021 school year mandated faculty, staff, and students to wear face masks while in school buildings during the COVID-19 global pandemic. An educational intervention on properly wearing face masks to minimize the spread of COVID-19 is necessary, as there was no guidance for methods to encourage this behavior. Methods: direct in-person observation was used to obtain non-compliance face mask infraction data. A pilot quantitative time series retrospective review design was used in this project. The results of 15 teachers who participated in the project: 105 observations were made daily for a total of 525 observations over a 3-week period. There was a decrease in non-compliance mask infractions post-educational intervention, week 1 to week 3. The average proportion of 0.1333. The Z-score was negative 2.3604, a p-value of 0.091, and the Z-test revealed the p-value of 0.0091 is less than the significance level of 0.005. Conclusions: the importance of an educational intervention for proper use of face masks during the COVID-19 pandemic was needed and effective. Additional education in the form of announcements and videos would be helpful. And if the study is completed with a larger population, inclusive of all teachers in the school building returning to remote in-person instruction, or students returning to remote in-person instruction, more observers would be needed. Evidence of effectiveness of face masks. Per the CDC, and as we knew it in 2020, masks are the most important weapon to combat the spread of COVID-19. They reduce the user-generated droplets or particles released into the air. Masks are particularly important when social distancing, at that time 6 feet, cannot be maintained. Here is a nice image of no mask versus mask to reduce transmission of COVID-19. If you look at the top picture, the infected asymptomatic lady has no mask on, and the healthy individual with the mask is getting the maximum exposure. Where if both individuals wear a mask, minimum exposure of particles in the air or transmitted. The beginning of the DMP project. A pilot quality improvement project was implemented to address mask compliance for teachers returning to in-person teaching during the COVID-19 global pandemic. The literature review did not identify standard or educational tools to enhance mask compliance during in-person teaching. Therefore, the educational intervention created by myself included guidelines from the CDC, World Health Organization, IDPH, and the Illinois State Board of Education in the form of PowerPoint presentations, videos, posters, and daily announcements. The awareness presented in the evidence-based educational intervention will and did increase face mask compliance. The Quality Improvement Project was a quantitative exploratory design that utilized a time series retrospective review to analyze the impact of the education intervention on mask compliance. As you can see, this picture shows the 3 guidelines that you should follow to protect yourselves from COVID-19. We are focused on the mask, wearing the mask, and then social distancing is another one, at least 6 feet. Washing your hands, hand hygiene, making sure you don't touch your face. And if you touch surfaces, to make sure hand hygiene is completed as well. The do's and don'ts of wearing a face mask. So, proper technique of wearing a face mask: perform hand hygiene first, if you look at the top. Then you need to ensure the colored side of the face mask is facing outward away from the face. Ensure that the stiff, bendable metal strips are molded in the shape of the nose if you're using a surgical mask. And then position the straps, elastic bands behind the ears. Extend the face mask to cover the nose, covering your nose, mouth, and chin. The proper technique of taking off a face mask are as follows. So you are going to first do your hand hygiene. You are going to remove the mask by the straps or elastic bands behind the ear. You are going to either save your mask by putting it in a plastic bag or dispose of it in the proper receptacle, and then wash your hands once you have completed it. Target of the DMP project. This project was to educate staff by alerting of the importance of wearing a face mask properly covering your nose, mouth, and chin to minimize the spread of COVID-19 during the return to in-person remote instruction during a pandemic. The awareness provided an educational intervention should increase compliance of wearing a face mask while in school buildings, which was the standard practice set by the Illinois State Board of Education for in-person instruction during the 2021 school year. Methods implemented in the DMP project. A pilot quantitative time series retrospective review design was used for the DMP project. Participants for the quality improvement project were, of course, and again, junior level and CTE teachers returning for in-person remote instruction while at a public high school in the Midwest region of the United States during the 2021 school year. As a member of the COVID-19 task force, I use direct observation to measure adherence to wearing face masks properly, covering the nose, mouth, and chin during the allotted 5-minute class passing time, Monday, 9 a.m. Central Standard Time through Friday, 2:30 p.m. Central Standard Time, August 24th through September 4th, and reported to the school administration of those results. For data collection, the researcher of this project extracted the face mask noncompliance infractions of junior level and CTE teachers only and placed them in a Microsoft Excel data collection sheet. The baseline rate of noncompliance face mask infractions was calculated at the end of week 1, and then the rate of non-compliance face mask infractions was calculated at the end of week 2. Week 1 to week 2 of non-compliance face mask rates were compared, and then the rate of non-compliance mask infractions was total from week 3 and compared to week 1. Also, week 2 was compared to week 3. The results of the DMP project in table 1 here that you can see, face mask noncompliance mask infractions observed over a 3-week period. So we have class periods 1 through 7, and then we have week 1 going from left to right. Week 2 to week 3. A total for week 1 was 83, total for week 2 was 89, and total for week 3 was 57, for a 3-week total of 209 face mask infractions observed. Results of the DMP project continue. Figure 2A shows the non-compliance face mask infractions for each week in a nice pie chart here. Our week 1 is blue. We had 83, 40% of the total number of infractions were in week 1. Week 2, 69, 33% of the total infractions were 33% in week 2, and then in week 3, 57 were observed for 27% for the total infractions. Non-compliance mask infractions per day. If you notice, figure 2B shows the face mask infractions over a 3-week period. Monday had the most, 57, Tuesday 46, Wednesday 33, Thursday, ironically, was 33 as well. Friday was 40. Results of the DMP project. More results. These are the mask infractions for class period. This is what figure 2C shows. So period 1 has 47. Period 2 had 18. Period 3 41, 4, 52, 5, 14, 6, 31, and period 7, only 6. So data analysis of the DMP project. The difference of 2 proportions was calculated using a z-test to determine the significance of the educational intervention. There was a statistical significance of less non-compliance mask infractions after the educational intervention for CTE and junior level teachers in week 1 to week 3, with an average proportion of 0.1333, a z-score of negative 2.3604, and a p-value of 0.0091. The z-test revealed the p-value of 0.0091 is less than the significance level of 0.06, I'm sorry, 0.05. So the null hypothesis was rejected. I'm sorry. And the educational intervention was effective in decreasing noncompliance mask infractions from week 1 to week 3 post-educational intervention. There was no statistical significance of less noncompliance mask infractions between week 1 to week 2, and you had an average proportion of 0.1448 and a z-score of negative 1.2279, a p-value of 0.1097. No statistical significance was found in week 2 to week 3, where your average proportion was 0.1200, your z-score at a negative 1.1396, and your p-value of 0.1272. So in both week 1 to week 2 and week 2 to week 3, the null hypothesis was not rejected, so the educational intervention was ineffective in decreasing the non-compliance mask infractions. But we will note that each week, face mask non-compliance infractions were decreased. Discussion of the DNP project. The study's findings established the importance of an educational intervention for proper wearing of face masks in the COVID-19 pandemic for in-person teaching and learning in school buildings for staff and students. The data analysis results after the educational intervention from the beginning, week 1, to the end, week 3, support the aims of this project. Limitations of the study were bias in choosing a particular group of participants when all staff were required to wear face masks. Future studies require more observers to document mask non-compliance infractions. Additional education and reinforcement is needed on Mondays and during lunch periods, as our results showed higher levels on Mondays of mask infractions, and during the 3rd and 4th hours is where you had your highest numbers on our results slides. Observational investigations can be beneficial in rapid feedback on the proper wearing of face masks and the need for educational interventions to increase compliance. So if you're getting more face mask infractions, observing more face mask infractions, it probably is time for you to revisit, go back, and do an updated educational intervention in the form of a video, reminders, PowerPoints, posters, just to get people on track and in compliance of wearing that face mask correctly. Implications for nursing practice. The standard of practice is to wear a face mask during the 2021 school year. An educational intervention was a method to encourage proper wearing of face mask. Wearing face masks correctly minimizes the spread of COVID-19. New face mask guidelines related to vaccination status are in place for the 21-22 school year, and these were adopted by ISB, Illinois State Board of Education. They are the recommendations of the CDC guidance. So it requires K through 12 schools to wear masks for all individuals age 2 and older who are not fully vaccinated. This change in the new guidance still necessitates an educational intervention regarding proper wearing of face masks to minimize the spread of COVID-19 as everyone is not vaccinated. Future research is needed to compare COVID-19 positive cases from the prior school year under the old guidance of wearing face masks for all to no face masks this school year if you're fully vaccinated. The rise in cases and less vaccinations being given, the CDC and IDPH will revisit the new or the need for face masks for all, regardless of the vaccination status. My name again is Stephanie Tate Paterson. My email is statepaterson@gmail.com if you would like to get in touch with me regarding this project. Question and answer of the DMP project. I will put the conclusion up again. The importance of an educational intervention for proper use and wearing of face masks in the COVID-19 pandemic, which our results prove or show that it was effective. Additional education in the form of announcements or videos is necessary, especially during those lunchtime periods and on Mondays when we have had our weekend to our downtime of masking, so we don't have our mask on at home necessarily. Study would require more observers to document face mask noncompliance infractions if you want to broaden the population of participants. Here are my references. I thank you for listening. Have a good day.